Welcome to the Bone Show, and I'm your host, Imari Niles.
And I'm Jonay Sutton.
And today we'll be talking about osteogenesis imperfecta, which is also known as brittle bone disease.
Brittle bone disease affects the connective tissues, more specifically collagen, and the overall skeletal system.
Moving on to symptoms. Some symptoms of this disease include pain in the bones, bone fractures. If you have a mild version of this disease, you will suffer a few fractures in a lifetime. If you have a more severe version of this disease, you will suffer hundreds of fractures in a lifetime. Also, you may experience a bluish tinge in the whites of the eyes, poor bone tissue formation, bowed legs, easy bruising, calluses, an enlarged head, may experience hearing loss, have physical deformities, scoliosis, short stature, and stiffness.
Collagen is a protein that helps strengthen bones, so a mutation or a defect in collagen causes osteogenesis imperfecta. 5 categories of osteogenesis imperfecta is primary defects in collagen structure or function of the COL1A1 and COL1A2 genes that encode type 1 pro-collagen. Collagen modification defects, collagen folding and cross-linking defects, ossification or mineralized defects, and osteoblast development defects with collagen insufficiency. Patients sometimes have a family history, but it's mostly due to new mutations. People have a normal or near normal stature due to absent or minimal bone deformity. They have loose joints and muscle weakness, and collagen structure is a little less than normal.
Type 2 of osteogenesis imperfecta is actually the most severe form of this disease. A person who has this type of brittle bone disease suffers from numerous fractures and severe bone deformity. They have a small stature, which most oftentimes accompanies underdeveloped lungs. This type is also lethal at or shortly after birth due to respiratory problems that stem from those underdeveloped lungs.
Type 3 consists of fractures often present at birth. They have a short stature, and the sclera has a blue, purple, or gray tint. Type 4 is similar to Type 3 with only slight differences. It's in between Type 1 and Type 3 in severity. Fractures usually occur before puberty, but the sclera remains white.
Treatment for brittle bone disease include bone strengthening medications, physical therapy, and orthopedic surgery, but there's actually no cure for this disease. Devices that doctors use to help strengthen the legs are splints, orthopedic casts that limit motion and promote healing. Medications for bone health help strengthen and build bones. These medications include teriparatide, alendronic acid, pamidronic acid, risedronic acid, The dietary supplements for brittle bone disease work alone or in conjunction with other treatments in order to promote health. One type of dietary supplement that people with brittle bone disease take is calcium acetate. Medical procedures for brittle bone disease include percutaneous vertebroplasty, which involves injecting a special cement through the skin and into the spine in order to repair a fractured bone. Surgery, you have bone surgery, realignment, lengthening, or shortening the bone. The surgery is to stabilize broken bones, which is external fixation, using a splint or cast to hold a broken bone in place so it heals properly. Orthognathic surgery, which is a surgery to correct deformities of the jaw, such as for an overbite or underbite. And the final surgery is distraction osteogenesis, which is a surgical lengthening of a bone by pulling two segments apart so that new bone grows in between.
Specialists that can be seen are physical therapists who will restore muscle strength and function through exercise, a pediatrician who provides medical care for infants, children, and teenagers, a medical geneticist who will diagnose and manages hereditary disorders, an orthopedic surgeon who will perform surgery for conditions affecting bones and muscles, and an endocrinologist who will treat metabolic and hormone disorders.
Osteogenesis imperfecta is a very rare disease. Only 1 per 15,000 live births in the U.S. are diagnosed with this disease. However, mild forms of osteogenesis imperfecta are very underdiagnosed in the U.S. There is no difference between race or sex in this disease, so African Americans are not more prone than Caucasians to get this disease. The age when symptoms begin vary. Those with mild forms may not show until adulthood, or it may be in infancy. Those with severe cases typically show fractures in utero. On this episode of Who Has It?
Atticus Shaffer is a teenage actor on the middle. He has type 4 osteogenesis imperfecta, and his short stature allows him to play characters younger than himself. He's had multiple fractures and rods attached to his leg bones to help prevent further fractures and to support him.
Signing off, I'm Imari.
And I'm Jonay.
Thank you for tuning into the Bone Show.
Them bones, them dry bones, them noisy dry bones. Foot bone connect to the ankle bone.